Good morning, everybody. April 1st, COVID-19 Town Hall update. Welcome. All those that are watching across Facebook Live land, welcome. I appreciate you tuning in with us. As you know, we always meet every Tuesday and Thursday morning, 10 a.m., same time, same place, same channel. Different information, different updates, and all important, all real needed, all vital. So today is no different, although it is a new month. So please, everybody, be safe as you are out and about. I know we all need supplies, we all need groceries, but something different about the first of the month, right? Uh, Everybody gets their GA checks and their retirement, and it's a free for all in our border towns. And so we ask that you be careful, perhaps even, refrain from traveling out abroad. Um, as of late, we've been hearing about the variants of the that are out there and are on Navajo. So please be careful. So again, at the first of the month, welcome again to our update, town hall update. And so we're going to start here. I have President Nez waiting in the wings here, but a moment of prayer for this time. Lord, by loss of loved ones, Lord, over 1,200 of our people, Lord, and much more across the United States, Father. We ask you bathe this time, this great time, Lord, Father, as we know tomorrow is Good Friday, Lord, and Sunday is just upon us, Lord, Resurrection Sunday. We know, Father, that things can look bleak sometimes, but there's always a Sunday in our future. There's always a reason to hope. And we ask for that your message, Lord, be magnified at this time, as only you can, Father. Touch your people, love, mercy, grace, Father, that surpasses all our understanding of peace, Father, to come upon the land, Father. Lord, as we pray for the land and the people, may you touch everybody. And Lord, also we ask and seek your knowledge and your wisdom, Father, in which to conduct this meeting, this town hall update, Father. As we receive the updates and information from our health professionals, Father, we thank you for them and their work and their diligence and sacrifice, but also that you would help us to use this knowledge and wisdom, Father, and for the benefit of the people all across the land. As leaders, we have that anointing. As leaders, we have that authority, Father, and let us walk in it humbly, Lord. And we pray, Father, that all across the land, that all the leaders, Lord, would do justly and act humbly and walk humbly with you, Lord. That we would love mercy, and your mercy, Father, is that we seek. So at this time, be with us, Father. Grant your wisdom and your knowledge, Father, and your message of love go out this resurrection weekend, Father. We give you all the praise and the glory. In Jesus' name, God. Amen and amen. So, yes, tomorrow being Good Friday, we will have a day I think most employees will be getting off a little bit early so they can just, be in a position, posture of just taking inventory about themselves and their lives and spiritual lives. So without further ado, I want to bring on our president, Jonathan Nez, who is waiting to give his updates. And then I'll, of course, be back here to give updates here from the vice president's office as well. So Vice President Nez, you have the floor.
Yate bene dan hinaskido da solsangido here Vice President Myron Lizer citizen behin ido kodoshi ya hanan hichikuna de neto de sai ya naido kidia ha elebenina kuta andi sahanda tle andi bada hasne yego ye ya de skid ko jo hanne hichikonde sai da nisel le tsaba ha zanda بعد هالنهجيدو نحن تاني بنا نشدش إنجيدو يادا هالسنتا تها نو دا تكوشينا خي شو كري عشانتي بيندل كديجيدو internet de linigia hot out hanen hija kundel kat shikero shunna aron hilpels and doles binia shun he kodo khashin hikade and linigi bilina das linigi bikeda do do ba da hoshia dinas nigi ya andi konas ni hoda shikeno sin benina kuta otlande ikle ni zedo chi ni chi bikedasti au kon dakhe hota وإن كل يادا بس أني هذا دي نهلا دو بعد هاليادو تلوش بيتخادا كس دي hand sanitizers that أجيدا شداش هذا يدكو الشيء يداش كيدو داخل هستخا كسلادو بالله نزاجي هات دين لي واشنطن دون هي زل إن دان لنجي جو كدو نانتين هيجي كده يلا هادو بناتشي كون هات بكين زيدو دا سينيلتا هذا هغن داسات خاتشو نيكدو vice president إنني لانا دانيتسن تياندا دا هديلنا دي بتلين دال إنجيدا هذا شدبت خودا لي ناليها باوند دي خيو أكونده بان صدا كشك إنو سين شا أدان هيد نيشان ده بان سن كش شي يجيش أوي دان هيدو نين ناس الله دو هيدا نا صدا كيس دولش شي بان سس كيس وشي that's all your common sense بالغانة كأشيكو نحن خاصلادو جوبان تزكيسو إنا أجل إيدولي جن ليغو تخددو كاهو تكويدة جي بالناتش جيان دهوشني تو أسا جدي يدا تو دي هات إيشي جيان دا نسن دانوسنجي دوي كويتش كون ستور غون داك خدا أشوان دي كويشي جي ناتش بان صدا كيستو هدان ده أشوان شكيرو شدنا دي كون أشنيجي نيشي بان ده ويلنا يادس كيت نيشي دات خيه كدو زيل إن دان لنجي يا بكين سو زيدو دي نانتين هيجي دالياجي به ناستيني كاتي جينج بندا نوتين هيرو هيه أكون كدلي بلغانا كده هتني دي إشلادين هاوت زوغو يا دي ناشنيجي كخوسنتراجي ناست تساتا بتساتو شاتنانا ناشني هوتا جو لي تو نانده آده هشيت يا دي كخوسنتراجي بتساتو ناشني هوتا نخانا ناشني دي كون إشلادين هاوت زوج دينا كيتشن دا نشين دا بعد خويلنا كاتي تنبي كي أبوكا يا إيشني كوجي آج أساكم ناسكاي هيكيني هنا هي لاج ناغاكي يا ديكي بدولنا دينا كدبا أوتسند بدولنا دينا دين ليتون ناند ناسنيجي نان النيديجي يانا ناسنيجي بدولنا so تلاكون دي كي شيشا أوتس شينا كدشا أوتس دوي يا دي شادوس نتدو شدوس جاتا دي نيا جو كدي يا بهوزن دي غادا أزتسند Hitra the nes gigo din the question tsagi ya UK variant de hinigi hida dol nahada akonde nahada as segoko ya di yego di nasnegi do ni ya na nasnegi yego ikije nasnish di betol nagi ya juna kiraba o tse betol na ande yijini ya at silgo do yego betkahanes ge hadina da benina kodon hijopa deni kesh eno thin khada tse di ya ani ya na nasnegi yego bikije na anshoda. So Asia ban sada kiss to lesh kedo shinako ke hot inigi do benago da bilagana bikiyato ke hot inigi. So hot ya hanen hije kona nishla do den nekeche dainosne la kon khadas khal shindo okoda bedone o de keda hat iniginde akoda bedone la kon azen khahadlo بعد از سگوشی یا کون نشنیگی نکدان نیشو داشت گیروشنه کونی که مسانی که چینی نلده اتو بعد از سگی ایدو کدا بدو نه آن هی آدو آن هیدین آدا نسده کیسه نیه کینی که نانی بیل نیخال چین بیل که داوی تینیگی دو نه که یا بکاو بعد اینگو دین نشکودی نیشو دین نشنیگی. But اینی که جهانانا سیتو دلتی President Jonathan Nez ni جهانانا سی. Just quickly updating folks in Navajo. Let me get Eli to put the chart up and the PowerPoint. Today's numbers: 30,095 people who have received the virus. Got the virus. I'm sorry. They also have updated the confirmed deaths. That's 1,247 of our Navajo people who've lost their lives to COVID. Our thoughts and prayers go out to them, to their families. And if you go to the next PowerPoint, gives you an overview of the year-long numbers of COVID cases daily. The last 7 days, we've been averaging about a little bit over 10 cases per day. Of course, it fluctuates, but the last 7 days, about averaging about 10 24-hour cases. Last Monday, you all remember we had 0 cases and 0 deaths. And of course, it's going to fluctuate like that because we're not out of the pandemic yet. Our young people are not vaccinated, 18 and under, 16 and under are not vaccinated. So there are clinical trials happening now on our young people. Pfizer gave out a report saying that for children, their vaccine has been effective, but it hasn't gotten approval yet. So we're still waiting for that. And that's why Navajo Nation, we're being very cautious. The rest of this country is starting to open up, and we're wanting to go out and travel. We just announced on Tuesday that the UK variant is here on the Navajo Nation. It's in all 50 states. All right. The media made a big old announcement that the UK variant's on. Well, why don't they talk about all the 50 states, right? I even heard this morning over 200 jurisdictions have the variant. You know, we did our very best to keep it off. And these, since we're such at an all-time low in cases, that also means we're an all-time low in testing our people, because people are not getting sick and there's no need to test large amounts of people, right? And those tests that have been are being randomly sampled, since it's really low. They get sent out and they check for the variant, and that's what came back. And we announced on Tuesday that the UK variant is here, and it was isolated. Western part of the Navajo Nation. It was an elderly who also received. This is very important. Received both doses, right? Both doses. People are running around out there saying, I got vaccinated. I can run around and go to wherever I want to go and not catch the virus. This tells you that you can still catch COVID-19, and in this case, the variant. And so we need to keep that in mind. But one positive thing, you know, we are thankful that this elderly person recovered. The reason why he recovered, or they recovered fast, was because of the 2 vaccines. And so that is why it's very important that we get the shots, because it's very effective. You know, the 2 shots, 95% effective. The elderly person had to go into the emergency room and get monitored, and the severity of the illness wasn't as big, right? It wasn't as severe as. So checked out and monitored, and those around the elderly was monitored, and no spread. I want to applaud the contact tracers for identifying that. And that's one of the reasons why these contact tracers are out there calling people, asking a lot of questions. And some of us, you know, us Navajos, we don't want to have anybody get into our business. It's like, why are you asking me all these questions? But it's important because we're trying to slow down this virus. So if a contact tracer calls you, it's all confidential, but they just want to make sure it's not spreading beyond that area, their household in that area. So I just respectfully ask that you be upfront with our contact tracers. And the next slide there identifies the comparison, I guess, of the two between the Navajo Nation and the United States of America. And the blue there is the United States of America. Look at the far right. You see that starting to go up? The states are starting to see an uptick in cases. And here on Navajo, we're very careful. And we got to continue to be very careful, ladies and gentlemen. Don't travel off the nation. Please, we plead with you. And our relatives that are off the nation, now is not the time to come home. Yet, Easter is coming up. Sunday. Look at what happened Thanksgiving, Christmas, and New Year's based on family social gatherings. Let's not make another same mistake as we saw this country go through. And all those numbers show, that second slide shows, I mean, we're almost out, it just seems to me like, through this pandemic. And we just need to just stay strong and stay vigilant. Ladies and gentlemen, please be careful this weekend. Easter Sunday, tomorrow's Good Friday. People are going to be wanting to do family gatherings. Yes, you can have your family gatherings that are right there within your household. That's the best way to push this virus away. And then others are going to start doing family gatherings, and we're saying, don't, please. Please don't. Wear your mask at all times. You know, the CDC has said, well, if you got your shot, if you got both your shots, you don't have to wear masks now. No, for us on Navajo, we're going to wear masks no matter what. That mask mandate is still here. The CDC has also said, well, you don't have to be 6 feet apart to talk to each other. You can do it 3 feet now. No way, not us now. Well, we're going to stay with the 6 feet because that's helped bring the numbers down. And that's why we're doing these gradual, slow reopening. So if a spike happens, boom, we're ready to act. But it's up to all of us out there. If we want more restrictions, then you'll see cases start skyrocketing again, and then we're going to have to intervene. We don't want to, because we want our Navajo people to understand that you have the ability, you have the power, and let's make a commitment. You know, I made this commitment a couple of times, all of us. Let's make a commitment. This weekend, we're going to be very careful. We're eating, we're going to be, doing it with our immediate families. We're going to be wearing masks. Let's commit to wearing masks everywhere, all the time, except for, of course, when we eat and drink water. But let's commit to that. All of us that's listening, to over 200, 300 people that are watching. Do I have a commitment? Come on, put some comments down. Say, I commit. Because that's the only way we will overcome this virus here on the Navajo Nation. If you go to the next slide here, it shows you the next PowerPoint there. The cases, the cases peaked in May and then declined over June, July, and August of last year. Then there was an increase in cases in September, and then we just saw a skyrocket over the holidays. And then cases began to decline in January 2021. If you can go to the next slide there, and now Navajo Nation is we're out of the second wave, based on what we have there. We're out of the second wave, and it's up to us to not go through a third wave. And look at the chart there. If you can go to the Four Corners chart, Eli, the Four Corners chart shows the Navajo Nation all in yellow. Yes, we're at a stage where we are able to go from orange to yellow. Remember, 2 weeks ago, we went from red to orange, right? On March 15th. And based on the numbers, now we can go into yellow, but ladies and gentlemen, we're not going to go to yellow yet because of the announcement that was made on Tuesday. So just be patient and be vigilant. Let's do the same thing we're doing. If you look at the PowerPoint now, you see how the Navajo Nation is all in yellow. Crown Point, you're in green. Good job, Eastern Agency, Crown Point. Green status, but the rest of the Navajo, yellows. It's good. Let's keep it that way. Let's get greens on there. The state of Arizona is yellow. The Utah is orange. New Mexico is orange. Look at Colorado is red. And you heard on the news that the variant and the cases, COVID cases, are going up all around the United States. So let's be proactive and tell our family members, be careful. It's okay. Let them be mad at you if you tell them to stay home. Right? Grandma and Grandpa used to tell us to do that, or Mom and Dad used to tell us. And that's our responsibility as a nation to hold each other accountable too, right? And so let's go to the next slide, which is the update in the vaccination. This is good news here, ladies and gentlemen. Again, we have 3 vaccines here. You got the Moderna, you got the Pfizer, now you got Johnson & Johnson. And guess what, ladies and gentlemen, right now the Johnson & Johnson vaccine is very popular here on the Navajo Nation. Maybe it's because it's just one shot. It's quick. The effectiveness against the virus, 60 to 80% against the virus was still good. That's your choice. But if you get Pfizer and Moderna, you get 2 shots, right? But once you get 2 shots, it's 95% effective against the virus, and also effective against the variants out there, the UK variant. Just like this elderly, received 2 shots, caught the virus, was able to recover a lot quicker. So U.S. total doses distributed 156 plus million, and total doses administered 126 plus million. Number of people receiving 2 doses 42 plus million. Percent fully vaccinated 13.5%, and the percent administered 81%. That's the United States wide. And of course, Navajo Nation numbers are included in that. But if we were to pull that out of the US numbers, Navajo Nation, total doses given, and this is as of yesterday, the 31st, 246,065 doses has come to the Navajo Nation. That's all 3 Pfizer, Moderna, J&J. Total doses administered 215,204 have gone into the arms of our Navajo people. Number of people receiving 2 doses 86,327. Percent fully vaccinated 40%. Percent administered 87.5%. Good job to our healthcare professionals, our vaccination teams. I mean, these teams throughout the Navajo Nation getting up early. Remember when it was really freezing cold weather out there? They were getting everything prepared for these long lines. We were there on the front lines, cheering them on and getting the word out. I just want to say, we want to say thank you to our vaccination teams, hundreds of them at times, working Saturdays and Sundays to get vaccinations out. And this 87.5% is a testament to the hard work of our first responders. And it's not just healthcare professionals. You had volunteers helping out, from all different parts of the country coming in, like Team Rubicon and even the Gaming Enterprise. There was just so many people that were a part of it. The CHRs, community health representatives, were a part of these. And we just want to say thank you to each and every one of them for their hard work throughout this pandemic. So just to let you know, I know these updates are for COVID-19 in terms of the pandemic, but I just want to let you all know too that we haven't been at some of these vaccinations lately. We're right now discussing the monies that are coming, right? The American Rescue Plan Act funds, and it's taken a lot of time with our division directors as well as leadership. Maybe we're looking at maybe close to $2 billion coming to the Navajo Nation. So now's the time to get projects to your chapters, water line, electricity, broadband, telecommunication. That's going to be our focus, and I think that's what the Navajo people want us to focus on, is water line, electricity, broadband, telecommunication. Don't get me wrong, there's so much other needs, yes, but a lot of the comments that we receive are in infrastructure, better roads, right? Rebuild those bridges and rebuild those roads and pave more roads. There's a infrastructure bill that's going to be introduced into Congress next week that's going to help with roads and infrastructure projects. And so that's what we've been talking about, and a lot of tribal consultations happening, where I, as your president, have been giving comments. How are we going to spend this money? How's the formula going to be determined? And what we're saying here on Navajo is it should be determined on four things. One is the total population of a tribe, right? And the land size of the tribe, right? And the workers, people who work here on the Navajo Nation, employees. And fourth, the how hard hit a tribe was. Here on Navajo, we got hit hard. I mean, there's no dollar figure for a life loss here on the Navajo Nation, and we've lost over 1,200 of our Navajo citizens. And what we need these dollars is help recover, right? That's what the money is for, is to recover. And so there are some monies from FEMA right now, ladies and gentlemen, and we'll have an in-depth discussion on this to help you. FEMA has burial assistance that was allocated up to $7,000. I know the Navajo Nation helped many of our Navajo citizens with burial assistance. I think it was on 2,500 and 3,500. So if you had, and this goes all the way back to the beginning of the pandemic, right? Last year, 2020. So it's retro. And so those of the families that want to apply for some reimbursements, FEMA can reimburse you that money up to $7,000 for a funeral. I know the council just allocated some general fund monies, but FEMA's got money. And so that's going to be a supplement to what we're helping out with here on the Navajo Nation. So we're going to consider that legislation soon. But for FEMA, there's money available. Check out the FEMA website. Those of you on internet, Google FEMA burial assistance. It'll give you some information. I know not everybody has internet or capability. That's where I'm challenging our Navajo Nation staff and employees that we should develop an arm, I shouldn't say office, but a team, let me put it that way, that can help our elders and our families apply for these FEMA, because you have to apply yourself as a family. And it doesn't come to the Navajo Nation, it goes directly to FEMA, and then FEMA reimburses you. But I think where we can help out is the application process. So stay tuned for that. We'll give you a little bit more information. That'll end my report. Again, we're not going from orange to yellow just yet. We're going to stay the course of being cautious. And we are also, as you know, the schools, the position of the Navajo Nation is schools to stay virtual, online only. There was an opportunity for the council to change that, but they tabled it. So with the tabling motion, that means the Navajo Nation's position on schools is to stay virtual and online. I know there are some schools that are going against that. And those of you that are listening, let us know which schools those are, because we will be sending them letters. And we, Navajo Nation, Navajo people, will be holding the school boards and the administrators accountable if there's any spread. And I'm going to share this with you because it was publicly announced that Shiprock reopened some of their classes, and there's already a case there of a spread of COVID-19. And that's one example of why we are wanting to slowly, gradually reopen, because our kids are not vaccinated, right? I mean, to me, that's one of those common sense that grandma and grandpa tell you. Adults, yeah, they're vaccinated, and that's why businesses are reopened. And some of you are saying, well, how come schools are not reopening and casinos are reopening? Because the adults are vaccinated, and so we just need you to get the message out there to our people that we need to be cautious and follow the protocols that are set in place, even by our council. So I'll stop there. Thank you so much, and continue to be strong. And we are resilient people, and we will get through this virus. Some of the normal is not going to be normal anymore, I think, really. But it's up to us to help each other out. So God bless you. I'll turn time over to our Vice President, who has been out there giving out food and supplies to our Navajo people. We appreciate that, for getting PPEs, and he'll tell you all about that. But this is how we do a lot of our teamwork here between Vice President and I, trying to cover as many areas as we can throughout this pandemic. So talk a little bit more about Tom O'Halloran on our next updates. Thank you so much. Go to our Facebook page. We got a lot of updates for you. We don't talk about here. This is really COVID-19 focus. There's a lot of great things happening in this administration, and those updates are there with the help of our Navajo Nation Council, 24th Navajo Nation Council Speaker Damon, and also our Madam Chief Justice Joanne Jane. So thank you, Vice President. Turn the time over to you. Thank you, everybody. God bless.
All right. Thank you, Mr. President. Yeah, we appreciate your updates. Thank you for everything you do. Appreciate your leadership as well. April 1st, here we are, a new month. First of the month, again, we ask that you refrain from traveling out abroad, by Navajo, by local, right? Kind of you search that. It's not like you're keeping from doing something. It's just should be your first choice to stay local, by Navajo, by local. So with that, those of you who have received all of your hardship money, and those that have received some of the CARES Act money and the latest COVID relief money. So congratulations. And this is a new month. It's actually Financial Literacy Month. It's a national thing that's out there. And we'll be signing a proclamation here to recognize April as Financial Literacy Month. But as you know, it's always great to be on top of wise money management. And what is your personal finance, right? We could always stop, I guess, our old habits, and provide future funds for a rainy day, provide funds for college, for our little children all across our land. We do have and promote the Arizona 521 College Savings Plan, and many more things. It's just great, and everything just starts with somebody advocating for it, and then their advocacy turns into championing, and next thing you know, there's a thrust or some momentum for a community, for a family, for a community, and then for a nation. So we hope that you would all, I guess, um, ascribe yourself to a better financial management of your money, especially all those new monies that came in, right? This pandemic has certainly made personal finances just that much more important, right? Some were able to keep jobs as essential employees, some were maybe hurt, limited hours, and some just totally weren't able to make money. And so again, there's multi levels of conditions, financial conditions that played out all across the Navajo Nation and the United States and the world. And so we're all in this together, but we're all impacted probably a little bit differently because of our holding, and because of our practices and our disciplines. And so we appreciate you all that have remained free from the virus, and we pray for those that have contracted the virus, and certainly those families that have lost loved ones, dear ones. We as leadership, we have to magnify our messaging in order to save those, right? You do a good thing when you come alongside and take up the burdens of others. And so that's what we do. Leadership magnifies those messages, and maybe even exaggerates them. So we appreciate President Jonathan Nez's leadership to that regard. And as we look to close out COVID-19 here in our nation, we need you all. And we certainly need all of our health professionals here that are going to be speaking here, giving their updates and from their knowledge and experience as, the best they can. They help guide and help advise the President and I, and our 24th Navajo Nation Council. So again, we're all in this together, and this information all should be taken as very prudent and very wise to follow. And we advocate for that as well. So as you know, I always do. I always give updates on what the pandemic looks like all around us. I think it's good to have all that knowledge and just information. Information is power, knowledge is power. So as we can make better decisions here, again, just a reminder, I knew we'll probably be talking about it all month here in April, that being Financial Literacy Month. I do sit on the Treasurer Kimberly Yee's Financial Literacy Task Force, and also the Arizona 529 Advisory Board. And so we'll be advocating for that on many fronts and using all of our media capabilities that are at our disposal and using that. So soon, very soon, you'll be hearing radio spots and ads, advocating for such as well. But this past year has exposed financial vulnerabilities to an extent that have not been seen in decades. So as we maybe look to regroup and reset even our own finances, I think we'll be the better for it by just paying it a little bit more attention, a little bit more diligence. And so again, we're all in this together, and please look forward to those updates as we'll be giving those out real soon. So Arizona is our real quick numbers update here as of today, this morning. Total positive cases for the year here, almost a million. I say almost, I'm just trying to get your attention. 842,192 total positives with 381 new cases. So yesterday there was 733 new cases in Arizona. So we need to continue to be vigilant. At least so we don't have those higher numbers, but it's still, potentially in the right setting or in the wrong setting at the wrong time, you could potentially be exposed. Apache County, 11,026 with 67 new cases. Yeah, a little high number from previous weeks. Navajo County, 15,669 with 0 new cases to report. Good job there. And Coconino County, rounding out our Tri-County area that touches on the Navajo Nation here, 17,091 with 15 new cases. New Mexico, total positive cases throughout the year, 191,652 with 277 new cases, again, statewide. San Juan County in the northwest corner of New Mexico is 13,745 with 12 new cases to report. Rounding out their counties that touch on Navajo, Gallup, McKinley County, 12,141 with 0 new cases. So good job there, all those in the McKinley County. Utah, rounding out our last of 3 states here that touch on Navajo, 385,641 with 514 new cases. So again, there's still positive and still I guess exposures that are happening. So we are continuing to monitor that for you all, as I know you all are as well. San Juan County in the southeastern corner of Utah, 1,851. There's one extra new positive there for San Juan County. And our own Utah Navajo Health System is reporting no new cases, and that total for the year end stands pat at 1,084. So that's the latest on our numbers here. And I was told Dr. Jim would be available. It doesn't look like she's on. So we will prep Dr. Va. She will be giving you her updates and information here as I close here. And we're very appreciative of all of our health professionals, all of our nurses, our respiratory technicians, doctors, and all hands on deck over at our health facilities, right? And we'll continue to, I guess, be appreciative of all their sacrifice and their diligence throughout this past year. And we know that they have families too, and so our prayers are for their families, that peace and that comfort are with them. And as they take each new day one by one, that they're reinvigorized with new energies, with new motivations to continue to be safe, continue to help our people, which I know is their primary concern. That's why they chose that profession. They are gifted. And they are doing a great and outstanding job by helping our people all across the land. So shout out to all our health professionals. Continue to be safe. Our continued prayers to be with you and your families here as you do a very good thing in helping us and the nation and its leaders close out this COVID-19 pandemic. So with that, I am all talked out. We appreciate President Jonathan Nez's updates and his leadership, and on to we got a whole esteemed cast here of health professionals and many more. And I think Dr. Jim, once she gets off her next the call that she's on, will join us here shortly. So with that, Dr. Vaugh, you are up to bat. You are up next, and we appreciate your leadership and your information and your hard work too, Dr. Vaugh. Yeah. And she could probably be on a call as well. So with that, Dr. Jim is there. Who's that? Oh, Dr. Jim. Okay, you're first. You got released from your call. Thank you for everything you do, Dr. Jim, and welcome. Yeah.
Well, thank you, Vice President and President. I'm sorry I'm running late, but I just want to always appreciate the town hall conversations about where we're at with the pandemic. I'm sure Dr. Vaugh will add, and the team here from the Health Command Operations Center will add to a lot of conversations here this morning. So yeah, binanon say Dr. Jill Jimin Schedule donne en the Sunny A look on the short chin ibashin do exchange the say dog is a fun additional not just on that a sin shadow. I think this will have this the I should be gone like today. So welcome for those that are listening and the call this morning. I just wanted to reiterate some of the messages that the team has been working from the Health Command Operations Center, that we reported the UK variant a couple of days ago in the western portion of the Navajo Nation, that we want to continue to encourage everyone to take all the precautions that they need to, that we have all practice on a daily basis. There is a surveillance team that is continuing to work on that, and Dr. Hammett might talk about that a little bit as well. And also, we are providing public health information on the B117 variant, which is also known as the UK variant. So if you're on our Facebook for Navajo Department of Health, and sometimes through the President's office, once we get that fact sheet out, you can read about it and learn more about the variant itself. And we are aware that it's quite transmittable, but I think as a team here on the Navajo Nation, we are currently maintaining our reopening plan at the current status until we have further discussions about the impact of this variant that was identified earlier or mid this month. So just to be aware of that, that we want to just encourage everyone to follow all the reopening measures that we have in place right now. We still have a curfew from 10 p.m. to 5 a.m. and businesses operate 6 a.m. to 9 p.m. every day. And we also are limiting any sort of public social gathering at 10 persons or less, even though you're among unvaccinated or vaccinated individuals, that you continue to wear a mask in these gatherings. We have allowed drive-up gatherings as of late last week as well. So follow the drive-up gathering guidelines on the public health emergency order. And as we continue to reassess the numbers and also the situation, we'll provide any new public health emergency orders to reflect preventing the spread. I think sometimes we have to consider that our numbers may look good right now, but in order to be effective in preventing an outbreak or a spread, there will have to be some decisions to support prevention of any sort of spread. So the more that people move and the more restrictions that we lift, obviously that has led to increase in cases in other states. So as the Center of Disease Control and our Prevention and Control have reported a number of times that the numbers that are increasing across the other states could be due to those factors. So I'm just going to be brief, but I encourage everyone to continue to take all the precautions that they need to, and just to be vigilant and encourage individuals to get vaccinated. So I'll take it back to you, Vice President, for the next presenter. Or do we have Dr. Vaugh? Go ahead.
Thank you, Dr. Jim. Yeah, we can bring up Dr. Vaugh. Earlier, we had ask for her to step up in your absence, but you came on and she may have been on another call. I think there's a lot of calls going on. So, Dr. Baugh, you are up next. Are you waiting in the wings?
Thank you so much, Vice President Leiser. And I will also be brief. And I'm just going to cover the updated indicators and just go into a little bit of detail of what Dr. Jim discussed. And we, of course, I'll open that up into what we, in regards to the B117 strain that was first identified in the UK, and then really set this up for Dr. Laura Hammett, our specialist here, to answer some of to go into detail, as well as answer some of the questions that might be lingering in everyone's mind. Okay, we're doing well, now what? And what can we do to continue to do well and protect ourselves here in Navajo Nation? So I'll go ahead and share my screen. And so the purpose of this is just to show you where we currently are, where everyone has already just, briefly touched upon. And these are our gating indicators. And the purpose of these gating indicators is really to communicate risk. First of all, to communicate the degree of community spread. What does that mean? It means that what is the current level of transmission right now across Navajo Nation? And then what does that mean in terms of disease risk to you or to anybody who's trying to go about their day-to-day activities, whether it's going to work, going to teaching at a school, or going just to the gas station or Basha's. And based on where we currently are, then what is currently recommended to do to continue to stay safe, understanding this is where our current situation is, but these are the other things that are happening at the same time in regards to national trends, the new variants, and vaccine efforts. And so, the good news is that Navajo Nation is doing well, right? And so, unlike other areas where they're worried about this high plateau, where they didn't come down low enough, we've come down quite a bit. We've come down where our case burden, the number of cases over a 7-day period, is in the green. And so we're starting at a low baseline. We would like to stay there. But that does give us some level of comfort that we've gone beyond even September periods. And that's what you're seeing with this curve here. It's only our second surge, and you can already tell that the curve is going much lower than where we started our second surge right after September Labor Day. Our infection rate, we have been watching very closely because we're seeing how the infection rates are happening across the 4 states, as well as across the United States. And this infection rate gives us almost like a early detection of what to expect. And what it means is that right now, one individual with COVID-19 is able to transmit this effectively to how many other people? And we aim to have it less than 1. And it still remains less than 1 at 0.94, but it's sort of fluctuating between like 0.8 and 0.9. And so we are watching this very closely as we put it into the context of the national trends. Now, what you see on this map is across Navajo Nation, you see a lot more yellow and green, right? Crown Point is in green. This is looking at the number of new cases over the last 7 days. And so again, it's telling us we are heading in the right direction. And we are watching the states very closely. Notice that Utah is in orange and Colorado is in red. Our test positivity has remained the same. It was 4% last week. It's still 4% this week. And in regard to hospital capacity, what we do know is right now we have not seen an increase in hospitalization. And so what you're hearing is across the United States, they're also looking at whether or not there's increasing cases, and is this resulting in increased severity of symptoms where people have to be hospitalized, right? And so you do track cases as well as hospitalizations, and then there's a delay in mortality or death. And right now we do not see that, and we do indeed have hospital capacity, ICU capacity here in Navajo Nation. But the visualization is currently being revised. Very important in all of this is the continued effort of contact tracing. Because when our case count is this low, what you want to do is you want to prevent further transmission. You sort of want to see If you see any clusters that are starting, we want to be able to get our contact tracers immediately on that so it doesn't expand anymore. And that will help us to keep our numbers low, if not close to zero, especially in light of all these different changing factors that are happening. Vaccines. And so you've heard this, there's this race of vaccination efforts as we're trying to vaccinate as broadly, as widely, as many people as possible. Before cases go up, before there's these opportunities for some of these more severe strains to really take a hold on a community or in a state or in an area or a region. And so right now, Navajo Nation compared to the United States, we do track this carefully. And if you're looking at just two key numbers, just at the bottom, looking at the entire US population, all ages, the CDC had reported that 16% of everybody across the age groups, including kids, are fully vaccinated. And that means that they've received 2 doses of Moderna, 2 doses of Pfizer, or 1 dose of Johnson & Johnson. Here in Navajo Nation, using all the entire user population across the 9 sites that area office distributes vaccines to here in Navajo Nation, in all age groups, we're currently at about 38% fully vaccinated. Now the strains. And so we've been watching this very closely. The Navajo Epicenter, along with the Navajo Nation Department of Health, have already stood up their Navajo Nation Strain Surveillance System, NS3. And for the first time, we have some visibility of what might be happening here in Navajo Nation. And so we already know in this region, we have all 3 strains that are being detected by or being followed by CDC, the B117 strain, which was first identified in the UK, the B1351 strain, first identified in South Africa, the P1 strain that was first identified in Brazil, have already been found in this region, whether it's in Arizona or Colorado or Utah. And we know for Navajo Nation, we reported our first case of B117. Why does this matter? These strains impact how effective our treatments are for COVID-19. It may impact how effective our current vaccines are. And it may impact how quickly transmission can happen. And so it's really important that we do look at this. We also track the California strain, which has been known to impact how effective our treatments for COVID-19 are. More specifically, if you've heard this, the monoclonal antibody treatments. And so it's really important for us to understand what's happening here in Navajo Nation, because it may impact some of the tools that we're using to try to fight and contain this outbreak. And so, as Dr. Jim mentioned and others mentioned, we are doing well, right? Most of our indicators, actually all of our indicators, are in the yellow, but because of the new developing information that we have, we are moving cautiously forward, right? And so the transition to yellow is being taken very seriously, and is being discussed very seriously on how to do this safely so that we continue to do well and protect lives here in Navajo Nation. Now, what I do want to show you is just some quick comparisons, right? Is that the Navajo Nation, as you see in orange, is definitely gone beyond even lower than pre-Labor Day conditions in terms of the number of cases. And that is a good thing. Whereas the US, you're seeing the blue curve slightly going up, and that's where they're reporting, is that more than half the states are having an increase in cases, and in some, an increase in hospitalizations, despite certain levels of vaccinations efforts that are happening. This is another good point, is that here in Navajo Nation, there was always this race to last, and we finally came in last, right? You see Navajo Nation compared to the red bars, which are the 4 states in our surrounding areas, as well as the other jurisdictions and states in the United States. And we are right now last. This map just shows you the trends of where things are popping up, right? And so here in Navajo Nation, we're doing well, but if you see the Northeast coast, the Northeast region is starting to light up red again. And then this is just a quick table just looking at that, right? I'm just going to bring your attention to two areas of concern that we have been looking at and watching their trends. It's Colorado specifically. Colorado was one of the first states that had sequenced a lot of the strains early on and started to detect a good amount and continues to detect a good amount of B117 cases. And it took some time for their curve to continue to go up. And now it's been increasing for quite a few weeks now. Their infection rate had started to tick up, and now it is indeed over 1. But look, at the same time, 30%, 29% of their population has had already 1 or more doses of COVID-19 vaccine. And so you see sort of these competing factors. And then what we hope to take from this is that we're cautious of that. And so we try to, one, detect, continue with our surveillance and strain detection here, but vaccinate as much as possible and take those precautions that Dr. Jim underscored so well to continue to protect ourselves. And so what does that mean? It means this. It means that we will continue to sequence samples so that we understand what samples are circulating here in Navajo Nation and how we can better prepare. Contact tracing is going to continue to play a huge role so that any little cluster that's starting to arise, we can work with the teams and cases on the site so that we can effectively isolate and quarantine cases and contacts so that it does not transmit anymore. Because even if you have those strains here, if we can prevent further transmission, then we don't give it the opportunity to really take a hold. And so this is why, despite vaccine status, it is really important to still continue to wear a mask, especially in public, physically distance, wash your hands, and then understand how to assess your risk. Indoor activities will always be riskier than outdoor activities. Looking at ventilations and efforts of ventilations, you go somewhere indoors, do they have the windows open? Do they have the doors open? The groups that you're moving in, are they all vaccinated? Do they have anybody who's high risk? Do they have kids who are not vaccinated yet? And so vaccination status is very important as well. And so all these different things that we have to ask ourselves to reduce personal risk is still very key as we move cautiously forward. And so I will stop there. And I believe I will hand this off to Dr. Laura Hammett. Thank you.
Thank you, Dr. Voss, for those updates. And President asked me to provide a couple of updates on research projects related to COVID that have been ongoing. I think everybody's aware of the Pfizer phase 3 clinical trial that occurred globally and then enrolled 44,000 people around the world, including 463 Native American individuals. This is a voluntary clinical trial that took place at more than 150 sites around the world. And on the Navajo Nation, all research must be approved by the Navajo Nation Human Research Review Board. Following their approval, sites in Chinle, Gallup, and Shiprock joined the study, the global phase 3 clinical trial in late September. And across those sites, as well as on the White Mountain Apache tribal lands, there were 277 people who volunteered to participate in the study. We've previously reported on the primary analysis, which found that the vaccine was highly effective, that side effects were generally mild to moderate. And based on this, of course, we all know the FDA granted emergency use authorization in December. And just this morning, Pfizer released updated results through 6 months following the second dose. One of the questions we've always had is, how long is the duration of protection? What is the durability of protection that may be provided by these vaccines? And so we have now updated results through 6 months following that second dose, which are also very encouraging results to see this morning. There were no serious safety concerns observed up to 6 months after the second dose, and side effects were generally consistent with what has been previously reported, meaning that people report temporary pain where the shot was given, tiredness, muscle aches, headaches, sometimes swollen lymph nodes. These go away typically after 1 to 2 days. The analysis confirmed that the vaccine is highly effective with 91.3% efficacy through 6 months after the second dose. And it was even more effective against severe disease. And I think that's what we're continuing to learn, is that even though people, may come down with a mild case of COVID after vaccination, for the most part, these are very highly effective against severe disease and protect against hospitalization and death. The vaccine was also very effective in South Africa, where the B135 lineage is very prevalent. And so that was encouraging to see that there will be good, I think we're getting data now that there should be good protection from these vaccines against some of the variants that are beginning to circulate. We don't have that variant here, but I think that's still a very encouraging finding. We are really grateful to the IRB for their guidance, and to the facility partners for their collaboration, and to all the people who volunteered for this study and made this possible. And we've presented these findings at agency council meetings, as well as to the Diné Hatathli Association, and meetings with the collaborating health facilities to provide updates on this study, as well as regular reports to the Navajo Nation IRB. I also wanted to provide an update about another research study. This is not a study that was done here on the Navajo Nation, but I think its findings will be welcome and relevant. People may have heard yesterday the announcement from Pfizer that the vaccine study that they did in adolescents showed that the vaccine stimulated a very strong immune response, and that the side effects were similar to what was reported in participants who were 16 to 25 years of age, those same things that I mentioned just a moment ago. And Pfizer is, we understand, planning to submit the findings of that study to the FDA to be able to expand to use this vaccine in adolescents down to 12 years of age. And hopefully that can take place by summertime. And so I just wanted to provide those brief updates on the Pfizer COVID-19 vaccine and the research project that did take place here on the Navajo Nation with the approval of the Navajo IRB. I'll stop there, and I think pass off to the next person. And I think there'll maybe time later if there are questions that we can take those.
Hello, this is Captain Brian Johnson, serving as the acting Deputy Area Director for the Navajo Area Indian Health Service. And I just want to take a moment to thank those on today's call, ranging from President Nez, Vice President Lizer, Dr. Jim, and Dr. Vaugh, and Dr. Hammett. I think there's been a really outstanding range of topics today on this particular Facebook session, covering the various, status of things in regards to COVID-19, while also working on all the way through the gating measures and how we're doing monitoring across Navajo Nation, as well as also finishing up with Dr. Laura Hammett providing information on research that's ongoing. Certainly a well-rounded discussion, and thank you all for that. Again, this is Captain Brian Johnson, and I serve at St. Michael's with the Navajo Area Indian Health Service, and work and participate on the Navajo Nation Health Command Operations Center with the Unified Coordination Group as well. And today I'll keep my comments very brief, as I feel like the comments have been, again, very wide-ranging and have been very informative as to the status of things. But in my few comments, I just want to emphasize that you know, yet again we're at a point in the pandemic where it's very critical that we remain vigilant. And when I say we, I'm talking about the healthcare system here on Navajo Nation, and I'm also talking about in working in partnership with our leaders, being Navajo Nation leadership in the executive and legislative branches, and just all the staff that's working across the board to make sure that we continue fighting the good fight against COVID-19. And we've had a phrase that we've said, let's reach community immunity, talking about protecting yourself, protecting your family, and protecting your elders. And I think that is a very relevant endpoint for this conversation today, in that we really need to be thinking not only of ourselves and what we're doing in terms of getting vaccinated, but for those around us, particularly our elders, and how important they are to everything that we do locally. And it's amazing, again, I know President Nez mentioned that we're over 215,000 vaccinations that have happened here on the Navajo Nation, which is truly remarkable. It's something that's being it's envied across the national specter, and we're just continuing to recommend to all of those across Navajo Nation, if you have not been vaccinated, it is the best way to reduce your risk against COVID-19. And as we've talked about on this session today, some may feel, you know, that we're in a very good place, and we are in a much better place than what we were previously. But again, vigilance in fighting this fight, it's truly important. And if you have not received your COVID vaccine at this juncture, we still highly recommend that. It's again, the most effective way to reduce not only your risk, but those around you, including your loved ones. And just wanted to further emphasize that. And at the national level, IHS continues. We'll be looking at our numbers here coming up, but one of the goals was to hit 1 million vaccinations by the end of March. So we're at the first day of April, and we're looking at the numbers, and I'm sure that those will come out soon to see where we landed. We know that we were over 940,000 vaccinations in Indian country in terms of COVID-19. So we're very proud of that number, and that goes with, it could have only happened with all of our partners, including the Navajo Nation, which again was involved in over 215,000 of those 940,000. So excellent job, excellent leadership. We appreciate everyone for what they've done throughout this pandemic, and we're going to continue to fight the good fight. And if you have questions, please do not hesitate to contact your local healthcare facility that you normally use. And I just also want to emphasize that COVID-19 testing continues to be available. And if you are demonstrating any signs, symptoms, or if you have a concern one way or another about being exposed to COVID-19, please, that's a service that's still available to the population. And we highly recommend that you take advantage of that if you have concerns in that area. Again, I'm going to keep my comments short today, and I'll be turning this over to Dr. Fowler shortly. But I just want to remind folks, other than you're getting your vaccination, as has been stated here today, please continue to watch your distance, wear your mask, wash your hands, and then really monitor and really think about the places that you go. Because while, again, we're in a good place with the pandemic, we do not want to lose any footing. We do not want to slide back up and experience additional cases. So we're all in this together, and we just all need to think about each other and how we can protect each other. It's a battle against the virus, and we're going to continue that fight. With that said, I'm going to believe I'll turn it back to Dr. Fowler and end here. Thank you all.
Thank you, Captain Brian Johnson, Dr. Va, and Dr. Hammett. I appreciate you providing us the information. Yat eshik edosh ne kodoina shit eche ma ideshkiz in instance for the chini bashichin. Tapahan dash che ado ache edashanale totus aholiere are is nasha ado katsaga hotzande e nashis. Asalate na tani itlini ajisato beshit itlit division a human resource director aja eshananish. Kodoshan iti ni is a in hatahasi iba atkahashnet ole. Dr. Ba in is a in aja na alkahiki aji kides in ko atin da alka ejin na kwandati na achahi ben chohot anigi eti the kwasantanas et atapedi nini bedol nai ado da alkahido is the entas kapatahas anado ado is the definitely ahatal ini jo holno ado yego na il kato bikisiti koditi atache ani yego yandes kid Ajashi yagoil kitten the dig at Litsogi, Litso, those Litso, sta atlet, all ye, a codibi e kai a Litso, a orange ne, ado dig at Litso be the kai a Litso, jo egg a adi ye ka a quande, dinal kai a so, a dot is good bi I katone jo halane hito sato atat a kodina al kahito betatel na da asa abetel na ko klache na is ne ko asa abich asa apeso a be wol kaista asa apeso le nast edo dejan ditsen da jo a 9.94 ne cuando age yego tenil ido antil ka akodin hit the nepel ka hot zoje dik ad tosted yiska gunne a di hit so ne yika a di dot is gunne dati ka I see yego dot katonil halan hinago hata hosoge ati sahodal chi do hit so Jogot nihinago ne kahigi hot oyo which ni tlinas di kahijo na kahi benache akodi izel ego netes kepet nahas ani da holodo yandes kit okonde nihinago ati oyo danel ido nanel ego hot added nas shi ben hinado According to Alkahi contact tracers, they kninigi asla abedor na natino ati agent olka. Eshi nadi kwa agent le kwaje agent la bajohot any Western agency. Eshi agent la bedor na it's kinton da aska ka enda alkahi asla as zin asla abedor na eti natina na ki agent wal in na alka. Akodi is a definitely bakasli ki jo ebdo bakatoti zendo nahan niti is the bahalani akodishje ya ad is lini nihit na ba alyani nihit chokol ya ina kide nezadina atadino astado ba the media jo honella en chokol ya akodi kai ba da se na kidneza dino ashla de milia jda skan neza dino ashla dino atepi akone lai ni kidne lini is ba alia ad is ba alia do bedes ni de ya se betino ana kidemilia ja atad neza dino anas et dino askan jokone la either fully vaccinated ikne akodi tostoit ini tlahoan o niliki esa pohon net hitene pelkaho zoje ako do ado depensa do sa pohon ado hos doje akondin hitin hitene pelkaho zoje asa an hitya ikni akonde jokodo yanda hasne ado di chiche is ba ya jashi chiche is ba o tsende Yego bechitna yichitna spati is the in lini ahne shinha or tsido is the ha elia Akwande hashin taka akwash jato big eshi dot Israel yon Giyado ahke desio the quishins ka akwande zado ya ateshin jitlek aho what it is da akwadi ya hod na egi edi klitsobi I kahi ya at don jono litsadon le dot ishibi ka ba ahui yado aha ne kachon ifna beninan hinago gi I sita Dahanana ni akwadi de ben sabet kahodzo I see the hotza akopa na sen shik edo shidne ado yat ana kahaton hitne ado di jashi hot and asharin hichidon his abetata des bar the skades and hit kawinos and hilatot handa gis ado di howana has age Hamasana hache hanale belhajije hachina hatso ketan limi ba ahonasen lada yego biche naho e oprago da jide ya banjitaho abedo jaho edo doshle doshide dorna dos no zi it eda don hitne is a it in ado dinaho ne e Dr. Hammett yadi is a bahazmi hatminiki na ketna han na I land le benitat so yizlen ta na khaya ta edi khashin sukan ol kha no edi na askha is igin dol khatodi editol ni lini ki to aj e Pfizer de lini e kha I khato hotel no le stand zit aj jono التسنيدو نش كونديات اند نانل از لني اهتا ني يego التسني ات جو كوديتي كودو بايت ني سيليجي Navajo Nation IRP دلنا هاشين لانكو بسنتا هويلنا ادو تين يبيش بحث اندا اجدو بشيدت اتو بسنتا هويلنا جنا اجي يا كونزن Adoti nahasahan lini hatfali association olia nihidina tan lini jo edo pasinta hui na fichede ano kodoya ho na edo ba ahetene si kwa bichinda hui ahi nihijine Adoti adnasko ne jo edi is a lini nanal ka as trans tahton le na tin stlabeda khegi baholo do no jo na ka Akwanda ado nasko nanal kaiden elchinen lini na kitata peda hedo teko. Edo ajna kahe ara tshanti FDA de lini gi alalaj. Eze yelanda itlehi na achina pahi. Jo eda tse enle ya istas chiledo de istas sote da zapaholodo hatne. Jo edo yana hodne. ROD Captain Brian Johnson, Ajo A. Ajdi Kodo is a Timberkaho, Georgia Aj, Etaladena, Tani, Le A. Adam Hicha, Roslyn, A. Aji Yifnadnish, A. O. Hihet, Hijanido, Hashina, Latna, Tani, Lini, Kwaat, the Neberkaho, Executive Branch, Sado, Beshbahasa, Anna Aja legislation, de Lini, Bechnail, Nishto, Nasko, Net, Nij, A. George Hifnail, Nishto. Halati kuhozagi ani hit na khasalla do shik eti tanosne hala has twisani taholno nihik taholno benna ashkhande nekha ot se hala zei etehne jne ado hne yadi national level de le at endeti eshlatino al khotzogi jo ya nasko ne bitsin ishklijido jo ajdo hita atkhani tha aji ke tenen lini to at en el sabata ot sito le asla at mil so aj etadil ni tajnot ya go lini itajila akoti adil khigen standards nas etino ati testin de media je koilke ka asla had de mil koshi it edol ke ako adoti izel ebnaz anon shik edosh na at ako dina shit ol ka oya des kosto shik yolda dobet ketan zna izel inko dina adnan det ol ka izel na hadol ni Joanit aan hinit out eya hilka atija kon hokotol ni johot okon hisne adoshik edoshne ohon yu aneta isno ai ihe nikidini do le khashino sa kabes ani fatadit naibik ahnos ado khashino sa e di yashin kakwinzen do yana hadizit eda kad afta anakhe Kodo ben hitcheta huilne do besnichil ishchane nilsen ba aquanossen ben achinotchen Johnny ne akotich ostoit ini saho ent od ni di nini ashin le khane kin tot tos yido belato na ho kostjo tona nante de shin de nesa na hotlo de bela ashtla ida tapeti na hota de na de shin UK de in the United Kingdom johot da hasna de shin kodahashin asan his ya ihni akwande is lini khashina la bahazli do bahalno Eheha kodobat sotol zenoshi kwa sato oswat anot ado hon de so tani ni hito sato oswat ado na not hini ni khalchini ni hito ken ni nali kes tuisani Johnny hishin hito hashin soko ben not hin eheha oshi yugo eheha beston na de Joti hot an hilko edo ba hehni zinda Hala hita huizato hita hosiza. Ado kat chibesa ot siton ehda. Does no zit eda. Okohashine la tenen lini di bichita bezeta do tata des balonda khe. Ado sa ikijata dos leisha de neta da no ahat sheita bin kitilu. Shidoshik etita da no da ado sa halle. Shadow shot or sister da no da big chan des ada hot ben hit nihit ho chik edo shidne a quad da an hinit out to jo ashit Asian na to no zi eda khala khatata ikali hak ein lini basta hagani hak e baha hasan e benina a kwichin kodo ben tahuil hana si a kwiche pan hashne to na kitamo do ti tamo el khasoneta tada and the panahosne benda ante ta hosya ashko de shno da pana inika Nije jo pa ta hono do hashin soko kodo yo tan hini nini benina hotan cha ha de se kedo shidne okon nije na go Dahanana ni ebinina etsa akon ado nanzago chanda ke etsa obeso da ni ashi ni ka achinen hi yajin hi awake o the day nation de etsa ahalo di kwanana ni hin etzago unta jobe hirta hasne ba hasni benina Ado kodo Easter another huishi edo ba ahusia ashi inni naha da asila osh yo asfa stoni sto di naho huji in hoyat ki ojo lohota haje da sota don jon da shik edo shidne ena ba ahusian hitine naha achine ni hitso ke ni masan ni hitche ajo ba hata nosen ani kodo chna do she yaj ye yati na antin it bohidil do be not need tin do nasko ne neje o koshan do jost now do joto do ti saosh echit edo Josani ni glini aden ti ke shik edo shidne Ako aden das ilta na atul keti is iltan lini ati kon na padedesh kis konoson ado aden koje shiyaj ken lini kon sa ta isa koje disa na aki disnia di de bije delia as khone بجئتيل تو خنطة شاشي باتلو تحسنده دنني تليني خن بجئيل أقوانده لا بجئي دون هيس أخوتات هني دا أجي هتا أجني دان نو أقوانده جو هو دا بنا نيتيني تو إيه هو دا بنا نوتيني أشي ني سهو خطا هتنزي سهو بالله ديليا سهو بأوهن ديل إهنده جو نيشيدو أوهيل آشيك دو شدنا دو كدو سادو يات بدان خوشجي أقوانده نتاز تويدو ساني داني شمسان هني لنده هذا دلي سادو يات خجئيلني هو بيدا خاوين بك هذا هون شياجش أوي او بقت ديلكس بقنانت دو شتوني أكو ساد هوت أنجلت دون جندا أخو بقت نهجيلنا دانشت نيل التو هوت آسان دانشت نستخا أكو كدو إيشي باخو نسندولين هزا باخو ليا هجو بيالتخي هذا دلي ساد هوت بيالتخي بينه هدت أولزي هدت أوني هو شون يدنا هدا أسي شند شين قد آدن أو شون خدا سوسي هن آدنا غاشا هدنين نا هدنين تو أكو بيتا أخذ نياشك دو شدنا أكو ساتاتنا أدلت كد آدن. We would like to, I'm doing some teachings in our Navajo language, so bear with me. A lot of times our Navajo language tends to be harsh, tends to be direct, but we want to appreciate our people and our listeners. At this time, we're opening up to some questions. If you may have some questions, I do have our our physicians that are still on the line. And let me see if we have any questions here. There was one question that I've seen earlier. I'm not sure if you've answered some of the questions here already during your. There was a question here. Let's go to Dr. Hammett. How do you feel about the Johnson & Johnson vaccine recent mix-up? And this person is waiting for the youth to get vaccinated. So how do you feel about the Johnson & Johnson mix-up? Dr. Hammett?
Thank you, Dr. Fowler. This was a really unfortunate incident. Vaccine production is very highly regulated, and there are many checks in place. And people have obviously heard earlier this week that human error resulted in a production error at a facility that's manufacturing the Johnson & Johnson COVID-19 vaccine. It was detected in the quality control checks, but unfortunately 15 million doses were ruined. These doses never left the plant, and the error does not affect any doses that are currently being delivered and used nationwide. It is a very unfortunate mistake, but it also points to the tight controls that are in place to ensure that the vaccine supply is safe. And I think as several people have noted, cases have begun to increase in many parts of the United States. The Navajo Nation has really led the way and showed the United States and the world that following public health prevention measures works to slow the spread of this virus. And compliance with the 3 W's, watching your distance, wearing a mask, washing your hands, as well as getting vaccinated, are critical to the continued control of this pandemic. And hopefully, fortunately, we've been in a position on the Navajo Nation to have good access to vaccines for people, that we can continue to make those available through IHS and through the tribal health facilities. And people on Navajo Nation have been stepping up to get those vaccines to protect not only themselves, but their communities.
Thank you, Dr. Hammett, for that response. I have another question here. Speaking of, this is for Captain Johnson. I know you've been in contact with this organization here. Speaking of contact tracing, did Fire Rock Casino do contact tracing when there is a positive case? And a two-part question: does the casino do in-depth sanitizing every night? If you can help us answer that on behalf of the casino, I know you and myself have been seeing their process. If you can help us answer that question, Captain Johnson.
Hello, this is Captain Johnson. I can't speak to the contact tracing. That may be something that Dr. Vaugh may be able to answer specific to the casino, but I can tell you that in terms of sanitization, our program, environmental health program with the Indian Health Service, have been working closely with the casino management. They've been open to any concerns, any practices, any adjustments in how to approach protecting the public that would be visiting the casinos. And I can tell you that it's been a very open conversation, and that the casino management has been very accepting to any recommendations we provided. So in regards to, I'm not sure that we can focus specifically on nightly sanitization, but I can tell you that in conversation with our environmental health staff, that the casino operations are involved in continuous sanitization efforts throughout the day, and I know that our program feels comfortable as to where we stand with that. So hopefully that helps answer the question to the extent it can be answered here. Dr. Vaugh, I'm not sure if you have any insight into the contact tracing question.
Sure. Thank you so much, Captain Johnson. And so our contact tracing efforts are very unified, from working as a unified team with HCOC Navajo Nation as well as Navajo Area IHS, down to the community level. And so for every case that resides within Navajo Nation, every case, every positive lab confirmed case or even probable case, the local public health teams, which we call the Epi Response Strike teams, they investigate those cases immediately. If they find that those cases are indeed associated with a workplace exposure, such as the casino, they will reach out to the Office of Environmental Health. They will also communicate it straight up to our contact tracing and case management team at the Unified Navajo Nation level, and work across the service units as well as with counties to try to reduce that transmission. And so what that means is they follow that case, they identify the contacts, they ensure that each of those contacts get tested appropriately, and they work with, like I said, the Office of Environmental Health to assess why that occurred within this workplace conditions. Was it because of ventilation? Was it because of the masks being used? Was it because of sanitation? And so all of that is a coordinated effort. Thank you.
Thank you, Dr. Vaugh, Captain Brian Johnson. I appreciate your response. The Johnson and Georgia, the Aben Sekesi be yet don't Haneta. Sahot the Haneto is the Deathnet Hanini Johnson and Johnson or Yeh, Dohot Ego, Ilya, the Hano, the Bahanei, Ekote. She Sato Yidis, Koto Yinatel Kid. Ashi need Dohot El Ilyan, the Joe Ape, Ajabanas, Lado, Joshi in that or Tleet Nihilne. Ado di casino but na has ago na de kid new and juno at the house and do ash le date or no na de kido ado satapetel na agent as kahish la baholo johot on need ajdi on a joshe but na has aj ni ko apik on zaj dan it has ado at the hand ido Jarago Ado Hotel Naho Adana as Kahida Oya Yohatanes Kegos to the Coso Edo Hunna Atada Ado Sapeto Nako Adeta qua ohen za di Israel in the alkha niki a kompethanne jo dot na ani da holla bechod ne dodi Israel in agent da alkha do Israel a bit has ano khanne etsetan alkha da no dat el khacho agent ani lini ba nasla ot kodon da de kid adosla ya na adedesh kilninda ashil behosn kodo be ekilta na do hehe nihijinne ko gun so go shi ya ko en hil na da hasil na do nihil ishta na ne ya shik do shidne ashkode shik no sini chas twis zani til cage okay nta nishina nish nihilik nas lahi atta akhwliya ado alkhahannossen ado khajala nahaja ala alalaje sho hey kwa lego adol wa deep in the yet adol was ade nata adana kidano hoto kato hoto ashta ado ad and the chinhel in that in ashi in niho wat etta hoste sla and na nishpata holna alto wate yugo ye na nish kodo ado do hel na has ada anit jo khajo be na tin hidin khago da do ashko den hichiton hize abata de spa gona ado hajon hitata de spa jon hi ota do asnidot en hitata des khashin ateshi hatanta khale do benos ago do hajon hichito ben hizebi es hibahon no sno ho wata sota joni hidetna hot ajo al oshi yo hashish kenalen jo hot ela bikidet ithi nleden na has des do bahon no sno edo do oho wata sota jishid na khaya ate Hakehat aho don jonda afto ade nakhaniyan eshi bedol na anhit khanni ado sahalle ebinina jobe da akhosiyado jobe na hina tinchik edosh na ashkhode kodo banan hinika zel inda ahate yanan khokha nihinat ani doshin nas tselle ani tena banan hinika Jashinat ani ni blinde do edo hashid eshi do not eat at unle but na ol wasle jo edo ati ne esto ba na ini ka kwichin shik edo shnen hits adol do eni zen ado na hatse da do sin kodoshi yas todim zini ihe vice president ni at en ho kodon hits hodezen at edo o ihe jo ani ya bi khadi khato bi ikha bet ada bi kedet tilo nasko net ne be khana ini nido enitzen akon so go shen kodo na nashtle do le I'd like to thank all our presenters, President, Vice President, Eli, Jared, thank you for setting this up. We appreciate all of you being on this call. Thank you. Have a great day. Happy Easter. Many blessings. And, furthermore, thank you.